Hello everyone, my name is Dr. Carlo Oller and I am an emergency physician, and in this patient education video we're going to talk about diarrhea. Well, first of all, what is diarrhea? And it really depends on how you define it, whether or not you have or not diarrhea. In medical terms, diarrhea is defined by the total output of stool in a day. So it's actually measured by grams or by weight of stool that you put out in a day. For most people, diarrhea just means watery stools, whether it be 1 or 20. If they're watery, we call that diarrhea. Bottom line is, however you define it, we still need to figure out why you're putting out too much stool, whether it's watery consistency or semi-solid. What are the causes of diarrhea? Well, most of the time are simple stomach viruses or stomach infections that cause the bowel to get irritated, cause a malabsorption, and then show up as watery bowel movements. Also, bacteria can cause diarrhea as well, an infection in the bowel, or bacteria that are not supposed to be there, kind of causing the inflammation of the bowel without there being actually infection of the bowel, causing you to malabsorb water and show up as diarrhea. Parasites are another cause of diarrhea that usually goes undiagnosed unless somebody comes out with, we've seen something weird on the diarrhea, it looks like bugs or parasites or something like that. Diarrhea can also be a side effect of medication. A whole bunch of medications can affect the GI motility and cause you to have more output of stool. Common antibiotics will do this. And then there's problems with the digestion of food. For example, people who have had their gallbladder removed have a problem with digesting fat. Too much fat in the bowel leads to malabsorption of water in the large intestine and therefore watery bowel movements. And then there's diseases that actually harm the bowel itself. And you know, IBS, irritable bowel syndrome, chronic bowel disease like Crohn's and ulcerative colitis, and many other diseases that affect the function of the large intestine, which is where most of that water absorption occurs, therefore leading to diarrhea. What can you do to treat diarrhea if you're suffering from it? Well, the first thing is you gotta put in more than you're putting out. So adequate hydration is very important. You must drink lots of fluids, but they must not be just plain water. It must have some salt and sugar. Good choices for these are mixed juice, flavored soda, but we usually recommend clear soda like 7-Up and Sprite and ginger ale and such. And if you're gonna eat soup broth, that means no food particles that you actually have to digest, but mostly the fluid and stuff. If you're drinking enough fluids, your urine should be light yellow and not be dark yellow or smelly. That'll tell you how your kidneys are functioning, trying to conserve water by concentrating your urine. Try to eat as little food as possible. If you can, just skip it all together and give your bowel a rest. If you must eat, then good choices will be potatoes, noodles, rice, oatmeal, crackers, white bread toast without any butter on it, banana, soup, and boiled vegetables. Salty foods are going to help the most because it also provides with sodium and chloride, which you're losing in the diarrhea. Some people can also take a medicine called loperamide, which is Imodium. And this is something you can get over the counter. You should not take this medicine, however, if you're actually having a fever or bloody bowel movements or severe abdominal pain, as these might be red flags that an infection is going on in your body. If you have these symptoms, my best recommendation is stop watching this video and actually go to a primary care doctor, urgent care, or emergency department. Because if you have bloody diarrhea, fever, crampy abdominal pain, and you're putting out this kind of diarrhea, you probably need stool cultures, you probably need a little bit of blood work, and you might even need antibiotics for presumed bacterial infections. These are the red flags that something more severe might be happening. If you do decide you don't have these red flags and you are going to treat the diarrhea with Imodium, then take it as prescribed on the label. It's important that you treat it aggressively as it recommends multiple doses of the medicine with each diarrhea, but not to exceed a certain number per day. If the Imodium fails to help, then there are stronger prescription medications for diarrhea that the doctor can prescribe. When should you see a doctor or a nurse? Well, you should see them if your symptoms are not better in about 48 hours, if you've had more than 6 watery bowel movements in 24 hours time, you have had bowel movements that have blood or mucus, if your diarrhea is black or sticky or bloody, if you've had a fever more than 100.4, if you have severe abdominal pain, if you're more than 70 years old, if you have diarrhea, especially after recently finishing an antibiotic regimen, and if your body has lost too much water or dehydration. You will know this because you feel lightheaded or dizzy, or your heart rate is fast. You have muscle cramps, you feel a little confused, you have terrible thirst or dry lips, sunken eyeballs, or like we talked before, your urine is way concentrated. These might all be signs that you are too dehydrated and you haven't done a good enough job about hydrating yourself orally, and at this point, you might be needing IV hydration. What tests you might need for diarrhea? Well, most of the time, you don't need any testing. If you had a few diarrheas, no bloody mucus, no severe pain, you will be treated symptomatically and you'll be discharged. However, if you had many episodes of diarrhea, we will probably check a blood count to check your white blood cell count. We'll check a hemoglobin to see that your blood count is normal and you're not anemic to begin with. And we'll check your electrolytes, your sodium, potassium, chloride, and kidney function. Sometimes a urine sample to look at the concentration of your urine, and then make the decision whether or not you need emergent IV hydration or not, and whether or not we need to treat this as a possible bacterial infection or viral infection or parasites or something else. Basically, the test will try to determine the underlying cause because that'll dictate the emergency management and treatment. Sometimes we'll need to do CT scans, especially if you have bloody diarrhea, because one of those things we want to rule out is colitis. And colitis is essentially an inflammation of your colon. The problem with colitis is it doesn't tell us what kind you have. And sometimes we'll have to admit you to a hospital, treat the colitis with IV antibiotics until we can get further testing like cultures on your stool bag to know if this is Salmonella, Shigella, Campylobacter, E. coli, or Clostridium difficile, which are potentially very serious bacterial causes of diarrhea. So how do we treat diarrhea? Well, we already talked about if we make the decision to stop it, we're going to use Imodium. If that doesn't work, we move to something called Lomotil, which is a prescription anti-diarrheal medicine. And there's other things like Pepto-Bismol and Kaopectate to kind of treat the bowel and slow the diarrhea down. The other way to treat it is if we think it's bacterial, obviously we're going to give antibiotics. But definitely we don't want to just do antibiotics on everybody with diarrhea, because then we can cause other complications like C. diff, Clostridium difficile. Basically, we kill all your normal gut bacteria that should be there. And now these other bacteria that are just kind of latent, living in your bowel, overgrow and cause a severe and potentially life-threatening form of colitis. Another treatment is going to be fluids, whether it be oral hydration or IV, stopping medications that might be causing you to have the diarrhea, and educating you about diet and what things to avoid, what things you should be doing. Can you avoid diarrhea? Well, you can if it's infectious, or if it's related to food poisoning, or if it's related to contact with people with diarrhea. So it's important that you wash your hands fully after you change diapers, cook, eat, when you go to the bathroom, when you take out the trash, when you touch animals, and when you blow up your nose. Basically, try to diminish the amount of bacteria and viruses and things that you're going to be touching and bringing to your mouth. If you have diarrhea, stay away from work or school until the diarrhea gets better. Even on the best case scenario with washing your hands and everything, there's still some microparticles and you can spread the disease and get other people sick. Also, pay attention to food safety. Don't drink unpasteurized milk or foods made with it. Wash fruits and vegetables before you eat them. Keep the refrigerator cold enough and the freezer under 0 degrees. That way your food doesn't spoil and go bad. If you cook your meat, make sure it is well done. cooking eggs until the yolk is firm and not runny, and washing your hands, knife, cutting boards after you cook or deal with raw food. Well, I hope you learned a lot about diarrhea and the causes and the treatment, and most specifically, the red flags, the things that you should be attentive for. And if you have these red flags, you need medical attention. Go to your doctor or emergency department. I hope this was educational and you find the information you needed. If you did not, I want you to send me an email with your questions and I will try to respond. My name is Dr. Carlo Oller, and for other medical videos just like this one, go to PatientEducation.Video. Thank you so much. Bye-bye.